A prominent name in the fields of surgery, research, and education, Donlin Martin Long, PhD, MD, retired in 2010 after amassing nearly 40 years at Johns Hopkins University, where he has since been recognized as a distinguished service professor and a professor emeritus. He served as a professor and chairman of the Department of Neurosurgery, which he helped build as a new collaboration between neurology and neurosurgery, and was regarded as one of the best of its kind under his leadership from 1973 to 2000, and a principal staff member of the Applied Physics Laboratory there from 1976 to 2010. He also held the position of neurosurgeon-in-chief at Johns Hopkins Hospital from 1973 to 2000. Prior to these appointments, he excelled as an associate professor and a neurosurgeon at University of Minnesota hospitals between 1967 and 1973. Dr. Long prepared for his career by completing an internship at University of Minnesota hospitals in 1960 and 2 residencies in neurologic surgery, first at the University of Minnesota's Health Sciences Education Center in 1964, and then the Children's Hospital Medical Center, Peter Brent Brigham Hospital in 1965. As a student at Jefferson City Junior College from 1951 to 1952, Dr. Long did not have aspirations to become a physician. He initially planned on a career as a chemical engineer. He then earned an undergraduate degree at the University of Missouri in 1955, by which point he had focused his studies on physics and mathematics, determined to work within the realm of research and education. Though he was not interested in practicing clinical medicine, he noticed that many of his peers were continuing their education at medical schools. Upon exploring the field, he decided it was the right path for him. He earned a Doctor of Medicine at the University of Missouri in 1959 and then began to pursue his PhD, during which time he became infatuated with neurosurgery, specifically the anatomy of the brain. His interest in the subject grew even more when he began his internship at the University of Minnesota, where he observed a young neurosurgeon by the name of Dr. Lyle French, a master surgeon who had operated on a patient with a brain tumor, a procedure which at that time often took 24 hours or more. He had completed the job in just 2 hours, and the patient was able to sit up and talk soon afterward. Dr. Long was gobsmacked by this and became determined to follow in his footsteps. Additionally, he felt a desire to care for patients, which he hadn't previously had. He obtained a Doctor of Philosophy in Neuroanatomy from the University of Minnesota in 1964. While Dr. Long's primary endeavors took a majority of his time and focus at the beginning of his career, they were far from his only responsibilities. He held rank as a neurosurgery consultant in the Minneapolis VA healthcare system, the John F. Kennedy Institute, and the Baltimore City Hospital between 1967 and 1977. Even in retirement, his productivity has not waned. Since 2015, he has lent his expertise, which specifically consists of treatment and research on tumors on the skull, complex spinal problems, and problems of chronic pain as a medical advisor at the Bobby Jones Chiari and Syringomyelia Foundation, an organization that focuses on unusual diseases and their effects on people. Those behind the foundation, including Dr. Long, have been working to raise awareness and increase clinical research surrounding these diseases. In addition, Dr. Long has found much success with the written word, having authored countless articles on neuropathy and surgery for professional journals, as well as book chapters. He is also the founding editor of Journal Spine and has published research papers on the effects of steroids on brain edema. Along with collaborators, he developed the first rechargeable, programmable, and implantable drug infusion pumps and electrical neural stimulators, and is the founding member of both the International Society for the Study of Pain and the Cervical Spine Research Society. Dr. Long has been affiliated with several professional organizations, including the Society for Neuroscience, the American Association of Neuropathologists, the Society of Neurological Surgeons, the American Association for the Advancement of Science, the American Medical Association, the Baltimore Neurological Society, the International Society of Pediatric Neurosurgery, the William T. Payton Society, and the Johns Hopkins Medical and Surgical Association, among many others. In recognition of his achievements and impact on the medical world, Dr. Long has accrued such accolades as the Beck's Medal from the Dutch Neurosurgery Society, the Gind Medal from the Indian Neurosurgery Society, the Distinguished Service Award from the World Federation of Neurosurgical Societies, and the Dandy Society Medal for Distinguished Achievement in 2018. Over the course of his remarkable career, Dr. Long has prided himself in his ability to solve problems and his strong commitment to patient care. He has been able to help thousands of patients in their battles with very serious diseases and ailments, which has been the most rewarding aspect of his work. He has loved learning from the people he helps, studying them and providing his students with the best training possible so they can be equally as helpful to their own patients. Within his students' careers, his values and methods will continue to live on and be passed down. He hopes to be remembered by his peers as someone who was always interested in helping to make situations better. As an educator, he hopes that his students have understood his efforts to make sure they're as prepared and well-equipped as possible to become physicians by teaching them to have a humanistic approach to medicine, instilling in them an interest in the intellectual aspects of medicine, and urging them to ask questions and find the answers themselves so they won't always depend on others. For those who wish to follow in his career footsteps, Dr. Long encourages them to never stop studying, never stop trying to improve your knowledge, and to always ensure that your primary mission is to benefit your patients and make sick people feel better.